Remember, nothing discussed or talked about on Dr. Langlois Live is meant in any way to diagnose or treat a specific problem or ailment in your own pet. Only your veterinarian can do that after careful examination of your pet. So if you do have any concerns about the health of your pet, why not give your local and trusted vet a call and schedule an appointment today? And now, on with the show.
Good evening, everybody, and welcome to Dr. Langlois Live. Hope this is coming through okay. I am Dr. Brian Langlois. I am the President-elect of the Pennsylvania Veterinary Medical Association, as well as the Medical Director of the Pet Pantry in Lancaster County. I do want to thank everybody for tuning in, and hopefully we're going to have a lot of fun this evening. This is a kind of a new format. I'm tinkering with a little bit of new software, so I do apologize if anything comes through a little weird or if you're hearing things multiple times. I am going to try to toggle between this and my YouTube stream live, so if there are any questions or problems, please just type a comment in and I will try to correct it as soon as I possibly can. But I do appreciate everybody's tuning in, and those potentially that are tuning in after the fact. Obviously this will be up on my YouTube channel, but I do again want to thank everybody for tuning in. And really this is kind of just going to be like a more of an informal, fun way of giving out some wonderful information about how to keep your pets healthy. Every month we're going to come with a different topic based on kind of maybe what's trending that month, maybe things that are in the news. We are hopefully going to have some special guests that are kind of give a little bit of information in more specific areas. This is going to cover all different types of animals, large animals, small animals, birds, chickens, fish. I'm going to try to get everything in there so you, as the pet owner or farmer, have the most up-to-date and accurate information. And I am trying to do this really for a lot of different reasons, but the main one is I really want people to understand that your veterinarian is the best place to get the most up-to-date, current, and accurate information about your pet's health, your farm animal's health, your fish health, your bird's health, your chicken's health. It doesn't matter. The internet is a wonderful resource, but as I like to say, you always got to take your pet to the vet, not the net. We do use the net all the time to research things, and there are some very good websites out there, and there are also some very bad websites out there that can lead people astray. And really, nothing is harder for me, and I think a lot of other people as veterinarians, to deal with when we see a problem that could have been corrected much earlier if a person had just really gone to the vet as compared to looking up something on their own. And we realize that, you know, we're not really trying to place blame on anybody here, but it is really important to remember that your vet really is the best source of information as we go through all this. And as like I said, we're going to cover a lot of different topics. This being the first one, as I said, I'm going to kind of, you know, if you bear with me a little, toggling in between the two views here, just to make sure that everything looks like it's coming through okay, and so far it actually is. So thank you for those that are tuning in right now. Hopefully we'll get some more as we go through. But, you know, I am going to talk about a couple of different topics tonight. And really, the first thing that we're going to go through is one thing that comes up a lot of times, especially when I do lower cost vaccine clinics. And a little bit later on, I'm going to talk about this low cost versus high cost versus normal cost thing that's kind of out there in the veterinary vernacular, and a couple of things I want to set straight with it. But one thing I always hear is like, oh, you know, it's so expensive for me to go to my vet, and, you know, I get charged $50 just for walking through the door, and I'm not going to pay money just to have my vet tell me that my pet is healthy. I think people really don't understand the value you're getting out of the physical exam. And that is something we're going to talk about in a couple of minutes. It's one of the main topics. It is January, towards the end of January, but it is January, time for New Year's resolutions, times for keeping those resolutions. And I want everybody out there to hopefully make a resolution to get your pet to the vet for a yearly exam. And it is really valuable information, not only for you, but definitely for us as well. And while you may think that you're basically paying money just for your vet to tell you that your pet is healthy, there are so many things that we look for in a physical exam that you may not even be aware of as we're kind of going through. So I really kind of want to take a little bit of time and just go through exactly all of the areas that we look to, and we're going to go from tip to tail as we walk through the physical exam. So I hope you realize that the next time you think about taking your pet to the vet just for a yearly physical for what it might need, it's not just $50 to walk through the door. In fact of the matter, your vet's not going to charge you at all for walking in and out of the door. You can do it as many times as you want. The only thing you might end up getting charged with is trespassing. So be a little aware of that. But here we go. And again, I'm going to try to click through these as we go here. So let's see how this works. We are going to clear that layer here. We're going to bring up the head. So basically, again, we're starting at the head. So this is really important. Like I said, we're going to go tip to tail here. So starting at the head, and actually, you know what? Let me back up for a second here. Let me come back online here and talk about one little thing. Actually, before we even start the physical exam, there's something that's really important for you to know. And we are watching your animal when they walk into the exam room. We're sometimes watching them when they walk into the facility. And we're picking up on so many things. Is your animal bright? Is it alert? Is it responsive? Does it look like it's moving normally? Does it appear that their mentation is normal? As I said, their alertness. These all go to things that, you know, subconsciously we kind of pick up on them, and you may not think that we're watching for those things, but we are. And sometimes if we're not making direct eye contact with you when we're asking questions and we're watching your pet, we're watching how they interact in the entire environment, and that gives us a lot of very useful information. So that's sometimes before you even get into the exam room, we're already picking up on that stuff. So let me clear this out again, and we're going to go back to the head. Okay, here we go. So we are going to start with the head, and basically, there's a lot of things that we're going to look at here when we look at the head of your animal, and we're going to move right on here. So let's see. The first thing, the skull. We are going to palpate your dog or cats or horses or whatever animal you have, head. We're going to be looking for things. Does everything feel normal? Are there any lumps or bumps? In puppies, especially if we're doing it, are all of what we call the suture lines or the fontanelle, the areas where all the skull is eventually supposed to close together, does all of that come together normally? Because those, again, are very important things. A lot of people hear about baby soft spots, and especially in a lot of these really almost like teacup breeds, a lot of these breeds, actually, their skulls don't form fully closed, and that's something to be very important of. We're going to look at the eyes. Does it appear that the animal can see normally? Does it follow things normally? Does the cornea look clear? Is there any sign of conjunctivitis or what we commonly call pink eye going on? Is there anything like that? Do there appear to be cataracts? Does there appear to be difference in the pupil size? Are they reacting to light normally? Does the retina seem okay if we can take a look at that? All of these things, we may be looking at it quick, but we are paying attention. The ears. Do the ears appear painful? Are they reddened? Is there a lot of debris in there? Does it appear that the dog will not even let you go near the ears? And in future episodes, we're going to talk more about a lot of these systems individually and what you have to look for. The mouth. First of all, will they let us in the mouth? And if they do, without us having to check out dental impression records on our hand afterwards, do the teeth look normal? And we may ask you some questions. Is the animal eating normally? Does it appear to have a problem? Is there any foul odor coming from there? Is there any type of weirdness going on as far as just the symmetry of the mouth? Or if it's a puppy and they're growing, are the teeth coming in like they normally would? These are all things we look at. The nose. Is there any kind of discharge going on? If it's a shorter breed, or shorter nose breed, I should say, like a pug or a bulldog, are the nares really causing obstructive problems? These are all things we look at, even going back to the mouth on these shorter breed dogs. We do look at that to see if everything is going well there. The nose, the teeth. The other thing that we look at that you may not even notice real quick are the lymph nodes. And up in the head area, there are two main lymph nodes. We call them submandibular, and they sit right behind the jawbone a little bit. We want to feel those to make sure that there's no problem going on there. So kind of moving on, we've checked all the stuff in the head out now. We are going to move on to the chest and the front legs. And as I said, we're just kind of going tip to tail here. So let's move on. Let's see what we got here. There we go. So what do we look, feel, and listen to when we look at the chest and the front legs? Well, obviously, and you're going to see this, some of these things are recurring through the entire exam. So obviously, we're going to check for any odd lumps or bumps. We're going to ask you if you felt any odd lumps or bumps. We're going to check the lymph nodes, the axillary lymph nodes. They're located in the armpit area. We're going to see if they feel enlarged or weird or for any reason. We're going to check the front legs and the front feet. Does everything ambulate normally? Is there any pain when we try to flex any of those joints? Is there any problem with the paw pads? Do the nails seem okay? Is there any pain or weirdness going on with redness or irritation in the paw pads? That's a very frequent sign of allergy conditions in dogs. And again, we're going to talk about allergy in a whole other show. And then finally, we're going to listen to the heart and lungs. And we are going to listen very closely for anything that you may not even perceptively pick up as being a problem with your dog. And that can include heart murmurs, which are very, very big, arrhythmias, which are basically a disturbance in the rhythm of the heart, or the way the heart beats. So instead of lump dub, lub dub, lub dub, we may be hearing lub dib 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 lub dib 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 dub 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 lub dub 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 dub. Or if we're hearing for murmurs, which is more of a structural abnormality in the heart, instead of the normal lub dub, we may be hearing sh dub, sh dub, sh dub, or something like that. And again, we're going to talk about all these different systems much more in detail in future episodes. We're also going to listen to the lungs. Do the lungs sound normal? Does it sound normal on both sides? Are we picking up any abnormal sounds that, while they may not be outwardly showing signs of having a problem, they may very well have some lung pathology that you as an owner would not pick up on, but we can pick up on it early and potentially treat it very easily if we do see your pet every year. So now we've gone through that. So now we're going to pop into the ever-popular abdomen, and as we move through there, again, we are going to look for any lumps or bumps. Are there any kind of weird masses, especially in older dogs? Older dogs are very prone to getting fatty tissue masses. Cats sometimes can have very tiny little masses that, we need to feel very carefully. Are there any skin abnormalities? And again, that's kind of going through the whole animal. Is there any pain in the abdomen? And we try to differentiate between true pain and just an animal that doesn't want their belly touched. And that can be a little hard for us as vets sometimes, especially if you have a very nervous pet going on. And so we will feel for that. We'll feel for any abnormal feelings in the organs. You'd be surprised how many times veterinarians pick up on something that is life-threatening in a dog, a splenic tumor, just by abdominal palpation. There's no signs at all, clinical signs. The owner thinks the dog is doing great. We take a feel of the abdomen. All of a sudden, we feel a large mass on the spleen, and that is a ticking time bomb. And there are stories all the time of vets that have saved dogs' lives just from being able to pick up on that splenic mass before it ruptured and the dog had a very, very serious and a lot of times fatal internal bleeding episode. So that's another thing we look for. We feel the kidneys. Do the kidneys feel normal? Sometimes we can pick up on kidney abnormalities before the animal starts showing signs at all, and we'll talk again in a future episodes all about the kidneys. Especially if it's a female, we are going to take very careful attention to the breast line. Hopefully your dog or cat has already been spayed or is scheduled to be spayed. But we will be feeling for any kind of abnormality, lumps or bumps in the breast line. And it's very important, just like it is in humans, to catch those things early and potentially have them taken out and biopsied and dealt with when they are very small, instead of waiting until you notice a large lump there somewhere that then becomes much bigger of a problem. And finally, we are going to check the lymph nodes in the groin area. We're going to see if we can go ahead and take care of any problems that we might feel there. A lot of times when we feel for lymph nodes, we're feeling for abnormal shape, size, and symmetry. So does one lymph node feel more enlarged than the other, which could indicate an infection somewhere in that part of the body that, again, maybe your animal is not showing. So it's really, really important to do that. So next, we are going to hop on over to the back. Cats are very, very good and elastic with their back, so obviously if there's a problem, usually you notice it pretty quickly. But again, here are some things that we look for. Again, we're going to feel for the lumps and bumps and just feel if there's anything abnormal. We're going to check the skin for any abnormalities, but we are going to kind of manipulate their spine a little bit. You might see us sometimes press down on them a little bit just to check to see how their discs feel, and are they eliciting any pain on that palpation, which could be the sign of a disc problem, and we'll be talking about that in future episodes, as well as could it potentially be a problem with arthritis kicking up that you may, you as an owner may notice once we start asking you, yeah, he's been a little bit slower, he doesn't seem to want to jump up as much, things like that. These are all things that we can pick up on when we talk about issues with your pet. And finally, as you can see there with our little short Quasimodo friend there, are there the normal number of vertebrae? You do get these weird genetic conditions where cats and dogs can actually have a shorter number of vertebrae or sometimes malformed vertebrae that cause problems later on in life or through their entire life, as we can see with our Quasimodo friend here, who obviously is doing quite fine. Then we move on to the wonderful hind limbs, and as you can see, our German Shepherd friend here showing off her legs so nicely. Let's see, whoops, I gotta pull up the, there we go, that's the one I want. So, The hind limbs, again, what are we going to look for? Any weird lumps or bumps. As you can see also in our kitty friend here are the hind legs, the only legs this cat potentially has due to either genetic malformation or previous trauma or something like that. And obviously this guy's getting along just fine. In smaller dogs, we're definitely going to feel your dog's back legs for loose kneecaps. We call them luxating patellas. They pop in and out. It's not uncommon to see things like that. And, you know, it's really important that we do find those things potentially early. In bigger dogs, we are going to palpate and do range of motion with their hips, see if they have any signs of potential early hip dysplasia that we've got to deal with later on. Is there any, as I talked about with the front legs, is there any kind of weird crepitus or change in the motion or pain in the rotation of those joints, things like that? We're going to check the lymph nodes again on the hind legs. There's another set back there that are very important and give us a lot of information. We're going to feel, if you see us ever kind of reaching sort of the inside of the thighs, we're actually feeling for the hind pulses. And we want to make sure that the pulses, sometimes you'll see us put a stethoscope on as well, and listen to the heart at the same time we're feeling the pulses. And what we're feeling for is any kind of pulse deficit, where we might hear a heartbeat, but we don't feel a pulse. That can be a sign of a problem in your animal, and it can only be picked up that way. You would never know that there's an issue going on there until disease processes progress so far that it's much harder for us to treat them. Again, we are also going to look for any skin abnormalities, and we're going to look down at the hind feet again, check the nails, check the nail beds, all of that stuff, looking for problems. So then finally, we are going to, whoops, I'm sorry. Not quite finally yet, but we are going to look at the part that nobody wants to talk about, the butt, and as we say, the naughty bits. And maybe if your dog is lucky enough to have some sort of divine intervention, you might see Jesus in his butt as well, as you can see here. So this was the rage of the internet a couple of years ago. I believe this was a pug mix or a pug. Somebody saw the face of Jesus and the body of Jesus in their dog's butthole. So I don't know if I'd go praying to something like that, but hey, to each their own. So what are we going to look at when we look at these types of things? Again, any lumps or bumps. We may check the anal glands. If your dog is intact, we probably will also be checking for any kind of tumors around the anal area, as well as examining the prostate. If they are not neutered yet, they should be, and we will talk about that later, but they should be neutered or being examined to be neutered. We will check the testicle size and shape to make sure that there are no problems. We'll check the vulva to see if there's any kind of abnormalities, discharge, things that might point to a problem. We'll check for any penile abnormalities or prepuce abnormalities in the males as well. And again, of course, we're always going to look at skin problems. So then finally, we move on to the back end, and that is the tail. So finally, we are going to look at the tail here, and for those of you wondering, this is the current world record holder in Guinness for the longest tail on a cat, 17 inches. That's pretty amazing. But finally, we are going to look for any kind of lumps or bumps or kinks, pain on kind of manipulation of the tail, because sometimes you can get those areas where, especially right where the tail base comes in, we may see, or some tail kind of attaches to the rest of the animal, shall we say, some damage there or some injury there, which can make them kind of hurting. Any dog that's had kind of swimmer's tail, sometimes you'll see a lot of pain in that area as well. So that's kind of all the things we look at from tip to tail. And now, you know, there's a reason I bring this up, and that is this. Looking at all of those systems, examining that, even if it takes only 5 or 10 minutes or sometimes shorter, you're getting an incredible value for your $50 in that. So really, it's hurtful a lot of times when we hear people say it's just too much to go to the vet, I'm not paying for the exam fee, that's ridiculous. It's not ridiculous. It gives us so much information. I don't understand why people get that upset about it. And we're going to talk about ways you might be able to offset that cost a little bit later on, and when we get into pet insurance and things like that. But really, don't dismiss the yearly exam. And there's a lot of reasons for it. I've gone through everything that we look at when we look at your pet from head to tail. And if you feel that your vet is not doing a proper physical exam, call them out on it and ask them, hey, you didn't look at this, you didn't look at that, I want you to look at this. Because really, you are paying for a full physical exam. You should be getting a full physical exam. So don't be afraid to ask for things like that from your vet if you feel that they're not. And your vet may be doing it and you just may not be noticing all the things, so they may say, oh yeah, no, I've checked this, I've looked at this while I was talking to you. Some vets will actually talk about the entire exam as they go through, and that's really the way it should be done. So those are all really important things. The other reason it's important for yearly exams is to pick up on things early. I can't stress enough how easy it is to pick up on things early and treat them early before they become a problem. And I probably see it more because I do mostly Humane Society rescue work, nonprofit work. So I see a lot of the cases that are referred to me when they reach a very advanced stage of illness. And that's either through when they are surrendered to the facility, or when they come to us looking for help because they can't afford now the major treatment that's needed at their local vet, and so we try to help them out as best we can. However, had they gone to the vet every year and had the animal checked every year, a lot of times you pick up on these things and they can be fixed very, very easily and inexpensively. Remember that when your vet sends you a reminder for your yearly vet visit. Don't ignore it. I realize it used to be that you just had to go in for the shots, and now that we've gone to vaccines every couple of years, and we're going to talk about vaccines next, that it's a concern for a lot of people. It shouldn't be. You know, go to your vet, get the yearly exam, set aside $5 a week. You know, give up that one latte or whatever it is, and put that into an expense account for your pet for the yearly exam. That's all it's going to take. That's going to more than cover it, and it probably will cover if you have multiple pets, having them seen. If you have multiple pets, talk to your vet. Maybe there's a multiple pet discount for the exams. Not every vet has them, but sometimes if you're bringing 3 or 4 in, they may only charge you half price for the final 2 vet exams. Not every vet does it, but it's something to ask your vet about. You know, these are all things. Don't forget to talk to us as vets, asking us about things. We may not, and a lot of times we can't necessarily provide exactly what you want, but we can work with you. And on that note, before we move on to vaccines, the other reason it's really important to get a yearly vet visit from your vet for your pet is because you then establish a relationship, which means that if you do have problems potentially paying for a larger surgery down the line, if you do have problems getting all of the money up front for an emergency procedure, your vet may be able to work with you more because they know you and they can trust you. They are very rarely going to extend that type of thing to if you're just walking into their office for the first time and the animal hasn't been seen for 10 years and all of a sudden it's a major problem. It really does build a trust, and I cannot stress that enough. So that's my soapbox for that. We're going to talk a little bit more about cost in a bit. But obviously this time of year everybody's probably getting some reminders, and there's a lot of questions about vaccines out there. I get them when we do our lower cost vaccine clinics. What do I need? What do I don't need? What do I definitely need? What do I don't definitely need? So we are going to talk a little bit about vaccines now, and let me just pull up the right thing here. Let me just check this real quick. Looks like we're doing good there. Okay, so let me pull back here. Again, bear with me, folks, as there we go, that's the one I'm looking for. And we are just going to pull that down. All right, there we go. So, when we talk about vaccines, you're going to hear your vets talk a little bit about what we call core vaccines and non-core vaccines. And basically, the most important things, and that we stress every animal should have, unless there's a medical reason for them not to, is core vaccines. And for dogs, that means rabies and what we commonly call the distemper-parvo combination. And for cats, that means rabies and the feline, again, what they commonly call distemper, but it's really not distemper. It's feline panleukopenia, which for some reason is called distemper. Just got into the vernacular. Caleci and rhinotracheitis or herpes. For the dogs, distemper, the D. H is hepatitis. P is parainfluenza, which is an upper respiratory virus, and the other P obviously is parvo. These are the big things. Now, before I go any further on vaccines, because we do get this question asked a lot of us too, I do want to bring myself back here and talk about this real quick. There is a video out there, and there is a veterinarian who's been pushing for a while, I believe it's in Connecticut, talking about how you really should be giving half doses of vaccines, especially rabies, to smaller dogs because you really don't, they don't need the whole thing. I want to make something very, very, very clear right now, and something that has to be understood. Vaccines are not volume dependent. Okay, it's not based on the sheer volume of the liquid that you give. It's the amount of what we call the adjuvant, or the amount of the virus, inactivated virus, that is there, that has been shown medically and scientifically to provide the proper immune response. If you follow the logic, a lot of these people that propose these like half-dose vaccines, it's like, well, if you're giving, a normal dog 1 cc, you should be giving a small dog a half cc. Well, by that logic, you should be giving a Great Dane 3 cc's, and we're not doing that. You're not increasing the dose for a much larger dog. A lot of these studies are done on your basic average beagle. They're the easiest ones to study, and in the larger, more outgoing studies, yes, they do look at this more in the general population. It is not volume dependent. You know, a dog that potentially has a vaccine or a reaction, or a cat that has a vaccine reaction, more than likely was going to react to that vaccine, no matter how much you gave it. It's not a dose, it's not a volume dependent thing. It is a dose dependent thing. And I cannot stress this enough. Because especially when you're talking about rabies, here's the question. Do you want to go to a half dose? And do you want your dog or cat to potentially not get enough immune protection? And then if they are exposed to rabies, two things are going to happen here. One, they may not have the protection and actually succumb to the disease. Let's remember here, rabies is 100% fatal. I don't care about those outlier cases that you hear about of every now and then of something surviving. It's 100% fatal. Two, if your animal, who is now under-vaccinated for some reason, bites another person or animal, the law and most vets are not going to consider your animal thoroughly vaccinated and protected for rabies, and that's going to have repercussions for you too. So don't be afraid to talk to your vet about these things with vaccines. I understand the concern that is out there for over-vaccination, and I am not saying to over-vaccinate. I myself personally follow a lot of these 2- and 3-year protocols that are now out there. But do not fall for the volume myth. Okay, it has nothing to do with volume. It has to do right now with a dose-dependent aspect of things that has been proven to show a true immune response. And it is very unfortunate when a major reaction happens in your animal, but these reactions are still very, at least the very, very severe ones, are very rare. Some of the other things that were talked about when it comes to vaccinating animals, when you look at some of these other autoimmune issues that pop up, yes, I do think there's a case of over-vaccination causing those. But as far as severe, immediate reactions, it is not a volume thing, it's a dose thing. Okay, so now we're going to pop on back here as I just shoot over to where we were. And there we go. So the core vaccines. These are ones that every single animal should have unless there is a medical reason. And again, your vet is the only one who can determine if there's a medical reason for your pet not to be vaccinated. Please remember that. So now we're going to go over to what we call the non-core vaccines. And on the dog side, basically there are 4 of them. There's leptospirosis, there's Lyme disease, there's Bordetella, or commonly called the kennel cough vaccine, and there's also now new and emerging the canine flu vaccine, and there's 2 formulations of that, and you can talk to your vet about that. Why we consider them non-core is this. We want to basically know what your animal's lifestyle is before we decide that we definitely want to go ahead and vaccinate for these things. And as I come back here and come out of that for a second, there we go. So when we look at a lot of these things, if you have a, let's say, a small little teacup Yorkie or something like that. It's an apartment dog, barely goes out except for walks, doesn't really interact with other dogs, isn't going to be hiking in the woods with you, isn't going to really be exposed to a lot of other animals. There are some vaccines you don't need. You probably don't need Lyme vaccine. You probably don't need leptospirosis vaccine because these are ones that, you know, are usually seen more in areas where you have a lot of wooded wildlife areas, things like that. The kennel cough vaccine, well, if they do go to maybe dog parks or maybe they interact a lot with other dogs on their walks, you might want to still consider that. Same thing with canine flu, and we'll talk a little bit more about those in future episodes. So really it is something you need to talk to your vet about with lifestyle. If your dog is really a homebody and not a going out hunting and gallivanting in the woods in an area where there's a heavy tick burden, things like that, you know, you may not need those vaccines. Me being in Pennsylvania, I will say that you really do want to know what the kind of diagnosis rate of Lyme disease in dogs is, and that may sway you a little bit in your vet to maybe pushing a little more for that Lyme vaccine. But again, every case is individual and every animal is individual, so it's really, really important to remember that. So let's pull up the cat ones now, and it's going to be sort of the same thing as we get this set up here. There we go. So for the cats, a little bit more of a longer list. And as you can see, the sources here, these are the most recent guidelines that have just come out, both from the American Animal Hospital Association and the American Association of Feline Practitioners, which are kind of considered the big wigs in coming out with these things. Cats do get kennel cough, so you see Bordetella there. It's not always given. It's more of a shelter thing sometimes, but it is something sometimes that a vet may offer. Leukemia vaccine. I get this asked a lot. Does my cat really need the feline leukemia vaccine? And again, it is a lifestyle thing. If your cat goes outdoors at all, if there's any chance of them getting outside on a frequent basis where they may dart out the door or something like that, yes, I do think they need it because there's always the risk of exposure. I sometimes also tell people that they do need to get these vaccines if they have a lot of feral cats or outside cats that wander their house, because really this can be spread fairly easily through saliva, and just even hissing and spitting through a screen is enough. You know, if your cats maybe fight with an outdoor cat through a screen or something like that to potentially contract it. So those are 2 times when I usually do recommend it. The FIV vaccine, it's listed there as Noncore. I don't even think it's in existence anymore. I'm not even sure if it's produced or given, but it's on the list. FIP vaccine, again, a lot of controversy whether this actually works or not. It is something to talk to your vet about. I do think it still is out there, but it's very, very rarely used. Giardia is a gastrointestinal parasite. Occasionally we may use it on cats that maybe have, you know, chronic diarrhea or Giardia issues, but again, that's a very case-by-case one. And Chlamydophila, or what used to be called chlamydia, it's a specific eye infection. Usually, again, we don't give it. Catteries sometimes do use it just to kind of cut down on any kind of that infection or maybe a shelter situation, but it's usually not something you're going to see in your regular vet's office. So that's kind of the quickie on vaccines and core versus non-core, and I did want to talk, you know, obviously to everybody a little bit about, you know, the whole issue with dose and things like that, and things that you may see out there. Do you need to give a half dose and all this stuff? As far as the spacing of the vaccines, with rabies, a lot we are seeing basically, you know, that these vaccines are good for at least 3 years. And some of the other core vaccines, they're starting to show that as well. The labeling is not there yet, and unfortunately, sometimes by the vets, as we as vets, we're a little bit hamstrung by the way the law is written, so we do have to follow certain protocols when we do vaccinate your animals. However, one of the things that is also taking off, and something that you really should be aware of, is something called titers and titering of your animal. And this basically is a blood test that is sent off to a lab, and it checks what the immune level is for your pet. There's some controversy about it, I won't lie about that, as far as what is truly a protective titer. But if you have an animal that is potentially maybe more prone to vaccine reactions or something, talk to your vet about maybe getting them titered and seeing what their titers are. And you can talk to your vet about that, and maybe if the titers come back low, then you booster for certain vaccines. But it is, again, a discussion to have with your vet about things like that. So that kind of covers the vaccine thing. Now, on the topic that I also hear a lot, because I am in the nonprofit world, and we use this term a lot, and I don't like the way a lot of it is used. And that term is low cost. And you'll see it advertised everywhere: low cost vaccine clinic, low cost spay-neuter clinic, low cost whatever. The term low cost is a little bit of a misnomer. The cost that you are paying, yes, that's lower. And I actually prefer the term lower cost spay-neuter or lower cost vaccine clinics, because what that implies, which really isn't true, is that the rest of the veterinary community out there is high cost. And there's a reason that myself in the nonprofit world and some of these other places that are nonprofits can do things at a lower cost. And for the most part, it's because we have access to revenue streams that your regular veterinarian does not. I can go out and I can ask for a grant to be written to our organization for $100,000, and that can cover God knows how many vaccinations. If I'm getting that money from the granting organization, then I don't have to try to pass that cost along to you as the pet owner. So that's why we are able to do it. Same thing with major medical procedures that potentially I or another nonprofit can provide at a lower cost. It's because we can go out and we can ask for donations to subsidize the rest of that cost. So please remember that. Most veterinarians out there are not high cost. Are there some out there that probably price gouge a little bit? Honestly, absolutely. I think that's naive to say that there aren't. And I think it's naive to think that it doesn't happen in our profession like it probably happens in every other profession. But that percentage is very, very, very low. And I don't think it's right to vilify the entire veterinary profession just because there are reasons they have to charge what they charge. And veterinary care costs money. And I do sympathize with a lot of these people when a tragedy does strike and they can't afford the regular vet care, or something comes up where they haven't been getting yearly visits where you might have been able to catch this early, and the vet is really advising do this now, and then it becomes a major problem. These are all things that are very concerning to me, because I see so many things that can be prevented. And I don't want people to think that your vet is just trying to charge you a bunch of money because, oh, we're just money-grubbing people. That's not it at all. You talk to the average vet, trust me, we are not living the high life. I hate to break it to everybody, but there are very few vets out there that are. A lot of us struggle on a daily basis to provide even the basic necessities for ourselves and for our families. And trust me, we are very sympathetic to cost pressures. And if we could do this just for the love of the animal, we would. But we can't. There are costs that have to be incurred, and there are costs that people have to pay for the care of their pet. And while myself and other nonprofit locations can potentially do things at a lower cost, that does not mean that your other vet is higher cost. They are normal cost in what it is. Because we have access to other revenue streams, or in some of these really high volume shot clinics where they can push so many animals through so quickly, yeah, they can do it at a lower cost because you're dealing solely on a production basis. So keep a lot of these things in mind when these things come out. It's really important to remember that your vet is not high cost, and we are not necessarily super low cost because of that. It's just something to be very, very much aware of. So let me pull myself back up here. I will get off my soapbox for that issue. And on the subject of cost, we are going to turn now to another topic that a lot of people have a lot of questions about as well. And that is, well, what can I do to potentially offset some of those costs? And so we now are going to have a little bit of fun talking about pet insurance. This comes up a lot of times, and a lot of times we have questions about it and what insurance plan is the best, what insurance plan is not the best, what do I look for in pet insurance, what does pet insurance actually do, and we're just going to talk a quick little bit about it and then exactly what you want to look at for important issues to ask of any insurance company. I will say this from the outset. Pet insurance in the pet health realm and the veterinary realm is nowhere near as confusing, nowhere near as frustrating, and nowhere near as annoying for the veterinarian as medical insurance is in the human world. And just to tread back for a second on that whole high cost versus low cost thing, really, if anybody who thinks that vets are high cost, next time you actually do get a human medical bill, open it. Even though your insurance company is going to pay most of it and they're going to negotiate really weird prices, look at it. Okay, and if you think our costs are high, then maybe you want to ask the local hospital why it costs $500 for somebody to actually just give you the injection. It's astronomically insane what some of these human healthcare prices are, and I think that's where a lot of people look at the difference between vets and human care, because they think they're just paying $10 at the doctor for a copay, and that's all they have to do. Okay, back to pet insurance. When we look at pet insurance, it doesn't work a lot like the HMOs or the copay systems or things like that. A lot of them are based solely on a reimbursement structure, where basically you pay the money up front, and then you submit the claim, and the insurance company reimburses you for what you paid. There are a couple out there now that are going a little bit more towards maybe a copay structure. Not really. They're on the fringes right now, but it really is a valuable commodity to have for your pet. I don't understand why more people don't have pet insurance, actually. It's a little bit surprising to me, and while many people may be a little concerned about the cost every month for the monthly premiums or whatever, or the deductibles, it really is worth it, especially even if you just get the catastrophic care. That's the biggest thing. It's not really necessarily the everyday care or things like that, but it's the catastrophic care that really helps people out. When you look at all of these things that come up when it comes to pet insurance. A lot of the big things that people have trouble paying for are the more major things. A major mass that needs to come off, cancer, major trauma that their animal may have incurred, some sort of major medical illness that costs thousands of dollars to treat. The premiums for this catastrophic insurance are not really that high. And that is something that everybody needs to be aware of and really should invest in. You may not see the value of it if your pet is a healthy 2-year-old right now, but when they are 11, 12, 13 years old and suffering from kidney disease and cancer and potentially some other problem, it certainly is something that is very much important to watch for. So let's bring ourselves back here to, oops, wrong button. Bring ourselves back here to the insurance, and we're going to kind of go over some things to kind of consider when you are looking for an insurance plan. The first thing to consider, obviously, is are you looking at an insurance plan or a wellness plan? And there are differences between the two. An insurance plan obviously covers for more catastrophic things or specific things that could go wrong, and every policy is a little bit different as far as what they cover and what they don't and how much you're going to pay for that coverage. A wellness plan is more something that you almost pay yearly, and some of the corporate veterinary hospitals have this. Some local veterinarians may have this set up as well, where you pay a certain amount of money up front every year, and that entitles you to either so many exams, so many blood tests, and maybe some other preventative care, vaccines, maybe some dental care. Every plan is a little different. But it's not necessarily going to cover you for the major things that may go wrong. Those may still have to come out of pocket or be covered by other insurance. So be sure to, check, are they a wellness plan or are they an insurance plan? Are pre-existing conditions covered? And this kind of goes along with, is there a waiting period or an initial exam required? A lot of these insurance companies still do require an initial exam to be done on your pet. The best time to do that is when they're young, healthy, and you first get them. Because then hopefully there won't be any conditions found, and it won't be a case of where maybe 2 years down the line the pet develops something. Well, unfortunately with the way your insurance is, that's your initial exam, which means that that may then be considered a pre-existing condition and they won't cover it. So it's important to remember all of those things. It's also very important to ask them if there is a difference in their policies between a genetic condition or a pre-existing condition. A lot of insurance companies won't cover something they consider genetically predisposed in the animal, and the perfect example of that is hip dysplasia in labs or rabies or something like that. They may consider that because it is so prevalent in those breeds, they will not cover the problems that develop down the line or major surgery to correct it when they're younger. There are some plans that do cover genetic conditions, and you want to make sure, do they know the difference between genetic conditions and pre-existing conditions? Is there a benefit limit? And this kind of does go a little bit with the human side. Is there only so much money that they will pay out on a particular animal? And sometimes that value may be $10,000 or $15,000, but if you've got a major problem with your animal that requires maybe a month of intense care, you can easily eclipse that, especially in a specialist center. So you want to know that. And finally, also, how is the vet paid? A lot of times, like I said, one of the drawbacks to a lot of these plans, and fortunately insurance companies are now starting to change that a little, is you still have to pay the money out up front and then you get reimbursed. And that's hard for people that may not have that $2,000, $3,000 to lay out right away up front and then wait to be reimbursed. I realize it is a problem. It's actually been a complaint I've had with a lot of the way the insurance companies work, and some of them are changing now where if they establish a relationship with your vet, and there's the whole relationship thing again, the vet will accept payment directly from the insurance company a couple of days later. So you want to talk to your vet about that if they work in that way and how all of that stuff works, because that can make things a lot easier and can be life-saving in a lot of ways. And then finally, as I said again, always, always, always do your due diligence. Always, always, always get everything laid out to you very perfectly as far as what is covered, what is not covered in these types of things, because a lot of times you may think something's covered and it's not. So you really want that laid out very specifically for you, and you want your vet to understand exactly what is covered and not too, because all these plans are different. Your vet may not be totally familiar with your plan, and a lot of times the vet will be asked to submit records or a form to the insurance company saying this is exactly what was wrong with your pet and things you have to worry about. So the final thing after going through insurance, and if you have any questions or anything like that, again, it is really important to talk to your veterinarian about this, because they are the best ones for information, and they probably have plans that they use more often than not and ones that they may endorse more often than not, from their own experience of which one is actually better for you. And a lot of it's going to be what's better for them too. I mean, let's face it, we are vets, we do have to get paid for our services, so we are going to recommend insurance companies that do come through more with full payment on these things. So the final thing that I'm going to talk about on this episode of Dr. Langlois Live is something that has kind of crept up, and I noticed it as an article the other day, and that is this. The issue with essential oils. And it came up through a blog or a Facebook post, I can't remember, of somebody who actually said that their cat became very, very ill from inhaling a lot of these essential oils that we use for ourselves. And it developed a severe pneumonia. Fortunately, the cat is doing better, and they are hopefully on the way to recovery. But it did bring up a lot of questions. Essential oils are very, very big right now. A lot of the holistic therapies and a lot of the diffusers, like you see here, are used by a lot of people for various ailments. Well, you have to remember, though, anything that you inhale or that you use in a diffuser or things like that, can affect your pets, and you want to talk to your vet. Not every single essential oil is bad, but there are some out there that we have concerns with that can be toxic to cats, and especially birds. If you have any kind of birds that you keep, you definitely want to talk to your vet, because birds are so super sensitive to almost anything in these weird vapors or things like that that, you know, can really cause almost instant death in them. And you hear really tragic stories sometimes of things happening to these birds because owners just did not know that their diffuser or their vaporizer or something they were even cooking with, you know, caused the type of fumes that were fatal to the birds. But you do want to talk to your vet about this. There are certain ones that are more toxic, and have to remember, even if you use these diffusers, it can still get on the pet's skin, and they can lick it off. It can still be licked off if they get some on their nose. A lot of people use these diffusers right next to their beds at night and things like that, and have their pets sleep with them. So it definitely is something that you want to be aware of, something you want to be you know, cognizant of as we, you know, go through with all of these. And you want to talk to your, you know, vet specifically to find out if some of these things are bad. It is certainly a cause for concern in a lot of these animals. And of course, you're going to see a lot of the holistic companies and the companies that manufacture these oils. They're going to say they're safe, and that maybe the oils that were used in these particular cases weren't as thoroughly vetted, or the source wasn't as perfect as it should have been. But their oils are different. They're trying to sell a product. I mean, you know, and a lot of times their products probably do work in some way, shape, or form. But remember, they are trying to sell a product, so they're responding to the negative pressure on the entire industry from a couple of cases that have caused problems. But AVMA and the ASPCA Poison Control Center have been dealing with a lot more calls about this, a lot more questions about this. You certainly can check out places. If you just Google ASPCA Poison Control Center, they really have some of the best info on this. Vet Poison Helpline or Hotline is another one that you can potentially Google. They have a lot of good information on this. And that will give you kind of the real reputable information as far as what you have to be concerned about with these essential oils. So just be careful. It is something that popped up, I would say, recently in the last month or so. You know, just in the news, it kind of triggered a little bit, and I just wanted everybody to be aware of that, and hopefully, you know, just, again, talk to your vet. I know I sound like a broken record on this, but really, people do not realize the amazing resource a veterinarian is. We have the most up-to-date information. We have the most accurate information. And I probably should state it that way more. We have the most accurate information. It may not be the most up-to-date, but just because it's the most up-to-date doesn't mean it's the most accurate. You know, we do realize that a lot of people spend a lot of time researching things and find certain things that say these things work, these things don't. There's a lot of tests, scientific tests, that we put through these studies that we read, and that these things that we read on the internet through, to see if what they're saying actually really is true. So, you know, keep that in mind anytime you're looking things up on the internet. As I say all the time, take your pet to the vet, not the net. I do want to thank everybody for tuning in for this first episode of Dr. Langlois Live. I am going to check just real quick to see if there's anything as far as a question that might need to be asked. It doesn't look like it. Looks like everybody stayed kind of quiet, which is fine. You know, I don't know if I want to sit there and listen to me talk all this time, too. We are going to make a lot of these hopefully more interactive in the future. This was a really good informative one, but I also did want to kind of test a lot of this stuff out to make sure that things are working really well. And now that I know it is, we're going to have a lot more fun as we go through with future monthly episodes. And next month, February, is Dental Health Month. We are going to talk all about teeth, all why it's important to definitely take care of your animal's teeth. I'm going to show you a little bit about what goes on behind the scenes when your vet does do a teeth cleaning on your pet, and that is something very important that everybody's going to want to tune in and watch, just so you can see exactly what we are doing behind the scenes, if you've ever wondered that. And I'm going to talk a little bit about some of the products that are out there, some things that work, some things that don't, some things that are gimmicks, and who knows, we'll have maybe some other interesting topics come up. Definitely, if you do have any questions you would like me to directly answer, potentially on the next show, shoot me an email at shelterdoc38. Again, that's shelterdoc38 at yahoo.com. shelterdoc38 at yahoo.com. I will collect them, see what I can come out. You can actually even comment also on this video when it goes up. It's obviously going live now, but it'll be archived on my YouTube channel. You can post a comment there. I will try to answer them on the next show. We are going to talk all about teeth, all about dentistry. I do, again, want to thank everybody for tuning in to this inaugural new episode of Dr. Langlois Live. I do hope that everybody did enjoy it, and hopefully you learned a little bit, you had a little bit of fun with it while we were going, and that is going to about do it for me. Hope everybody has a wonderful evening. We will see you sometime next month with the next episode of Dr. Langlois Live.
Dr. Langlois Live is made possible in part through help from the Pennsylvania Veterinary Medical Association. For all the up-to-date information for your pet's health, check them out at pavma.org. Please consider supporting these organizations that are very important to Dr. Langlois. The first is the Pet Pantry of Lancaster County, meeting the need for animals and their families in Lancaster County. Visit petpantrylc.org. Second is Pennsylvania Racehorse Rehoming, Rehabilitation, and Rescue, providing that all-important second chance at a great second life and career for retired racehorses off the racetrack. PARacehorse.org.